Dr. Smith, thanks for joining us today. Our topic is celiac disease, and the first question, what is celiac disease?
Celiac disease is an inherited autoimmune disorder of the small intestine. Patients with celiac disease have an intolerance or sensitivity to gluten, and gluten is contained in certain foods that we eat. The foods that contain gluten are wheat, barley, and rye. Now, when the intestine interacts with gluten in a patient with celiac disease, there's an inflammatory reaction that occurs. And this inflammatory reaction leads to cellular damage of the lining of the intestine. There are some finger-like projections in the small intestine called villi, and these are there to basically improve or increase the absorption surface of the small intestine. If those are damaged, then the surface area is decreased, and therefore certain nutrients, vitamins, and minerals cannot be absorbed. When this occurs, complications of other chronic illnesses can arise in a patient.
Well, doctor, what causes the disease?
Well, we don't know exactly what triggers the onset of celiac disease, but we do know that there are certain high-risk conditions in which celiac disease can present. Some of those high-risk conditions include autoimmune diseases such as lupus, rheumatoid arthritis, or Sjogren's syndrome, type 1 diabetes, certain other conditions such as autoimmune related other conditions such as iron deficiency anemia, osteoporosis, certain forms of liver disease.
And you kind of have answered the next question. You may have covered it. What are the symptoms of celiac disease? When do you begin suspecting that you need to seek a diagnosis?
Well, the symptoms of celiac disease are quite variable. In some patients, they may be quite severe, in others, very mild. The so-called classic symptoms that we see in celiac disease in terms of the gastrointestinal manifestations are abdominal cramping or pain, abdominal bloating or excessive gas, nausea, indigestion, diarrhea, or constipation.
Well, when presented with suspicious symptoms, how is celiac disease diagnosed?
Celiac disease is diagnosed first by having the patient examined by a qualified healthcare professional. The history and exam may suggest celiac disease. If a practitioner feels that it's warranted, certain screening blood tests can be performed for celiac disease. In a patient with celiac disease, antibodies are present in the body, and those antibodies can suggest the diagnosis of celiac disease. However, in order to confirm a diagnosis of celiac disease, an intestinal small bowel biopsy or biopsies would have to be obtained. The biopsies are usually obtained by a trained gastroenterologist using an endoscopic procedure.
Once you have a diagnosis of celiac disease, how is it treated?
Celiac disease can simply be treated by it's not a simple treatment, but celiac disease can be treated with a gluten-free diet.
Okay, and so let's define a gluten-free diet.
Well, a gluten-free diet is a diet which has complete avoidance of all gluten-containing foods, beverages, and products. It requires strict, lifelong adherence.
And give me examples of foods that would be then off limits in a gluten-free diet.
Well, in a gluten-free diet, wheat, which is present in most breads that we eat, rolls, those are off limits. Very difficult for some patients to follow such a diet, and they often have to order special products. Some stores do have available gluten-free products, and that will often be present in the label. Generally, if a patient has to follow a gluten-free diet and they have been confirmed to have celiac disease, we recommend they see a registered dietitian for extensive counseling in that diet, and often refer them for social support to social support group organizations.
Is there any way to prevent celiac disease?
Well, there's really no way to prevent the onset of celiac disease. However, in patients with certain higher risk conditions that I mentioned earlier, we might be able to diagnose it earlier, and therefore they can get treatment earlier and not suffer the long-term complications of the disease.
You mentioned earlier when we were asking the questions that it's a hereditary disease. It's a genetic disease, rather. So the question is it hereditary? Does it run in families?
Absolutely. There's a strong genetic component to celiac disease. It is inherited, and it does run in families. For example, if a patient is diagnosed with celiac disease, there's about a 10% chance that the children of that patient or the first-degree relatives, such as brothers and sisters, will also have celiac disease.
What happens if you leave celiac disease untreated?
Well, untreated celiac disease, unfortunately, can lead to some long-term chronic medical problems.
And some of those problems might be, say, examples.
Some of the long-term medical problems associated with untreated celiac disease include those conditions that are associated with malabsorption of the nutrients, as I discussed earlier. Probably the most common would be osteoporosis. For example, there's a reduction in the absorption of calcium. Iron deficiency anemia, reduction in the absorption of iron in the diet. Some peripheral neuropathies or other nervous system problems.
Let's define neuropathy.
Neuropathy is generally defined as a disorder of the peripheral nerves in which the transmission of nerve impulses is decreased, and the development of nerves and the ongoing regeneration requires certain vitamins. And in celiac disease, the vitamins, particularly the B vitamins, are reduced, and therefore the problem with nerve transmission can occur.
What are the long-term effects on the body from the presence of celiac disease?
Well, I just mentioned several of them. I mentioned the iron deficiency anemia, the osteoporosis, the nerve complications. Some of the other potential long-term complications associated with untreated celiac disease would be intestinal lymphomas. Certain types of lymphomas are more predominant in patients with celiac disease.
Aside from diet, is there anything else attendant to managing the disease? Does it require any other management other than minding what one eats?
The gluten-free diet is the treatment for celiac disease. Occasionally there will be a patient that is resistant to that type of treatment, and additional medications may have to be prescribed, such as a corticosteroid to reduce the inflammatory component, but that's very rare. Most patients that adhere to a strict gluten-free diet will improve, and the disease will go into remission.
Yeah, so that leads to the last question. Assuming compliance with the diet, will a person with celiac disease have a normal life expectancy?
Generally, yes. I believe that patients who are compliant with their diet and respond favorably to treatment should lead a happy and normal life.
Very well. Doctor, thanks for your time today.
You're welcome.